Thanks Rupak for this opportunity, and good morning everyone. I'll just straight away go into my videos. So I'm showing you videos of lens and IOL misadventures. So this is a case of post-traumatic aphakia. You can see that the corneal wound has been repaired, and this is on the constellation. So after doing a vitrectomy, we found a tear which was lasered, and I'm trying to do an aniridia SFIL in this, and with this 2-point fixation. So with the railroad technique, tenoproline suture, one straight needle and one curved needle is used, and this is the end result after that. Another case of a nucleus drop. We all know that IVTA is very helpful in initiating a PVD in these cases also, and then eating up the dropped lens with a phacofrag. Another case of a bilateral subluxated lens in a case of Marfan's. So this is an older video, so it was 23 gauge. Mostly I do my techniques 25 gauge now. So, and with the gentle depression from one side, you can eat away the capsular remnant. This is after SFIL in that case, the end result. This is an older video. I wanted to show that we could use a flute needle to lift the dropped IOL. So that is also another way in which, and this is a handshake maneuver, transferring the grip to the other hand, and then just taking out from the incision. So this is an older video that when we used to do 20 gauge surgeries, and this is again after IOL placement. This is a case of dropped IOL with the bag. So it's a very high myope patient post trauma, and patient had extensive myopic chorioretinal degeneration at the posterior pole. And again a handshake maneuver, this time the entry is from the limbus, and then enlarging the incision here, and then you'll see I'll just cut the IOL. First the capsular bag is kind of stripped when I'm trying to take it out, because the whole bag is also there. So I'm cutting the lens with the vanas almost all the way, and then just take out one fragment, half of the cut optic, and then rotate it out, and this is the capsular bag coming off, and then just rotate it so that the other half also comes out. The patient was left aphakic because patient had extensive myopic chorioretinal degeneration. So in some cases in which there is a good residual rim, you can place. Manish was mentioning that we should avoid doing using these lenses in the sulcus, because they can cause some complications. But sometimes we do use them in the sulcus. But ideally a 3-piece should be used in such a setting. Sometimes you can hang the IOL from the iris and then grasp it. If it's a 3-piece. That technique also works, as you saw here. And then an AC IOL is being placed here. Not all cases need a pars plana approach, and you can sometimes, if it's a limited dislocation, you can manage to dial it back if there is enough residual rim, capsular rim. So like in this case, it was managed without a pars plana entry. So I have I'll just show you one last video. Yeah. So this is a dropped IOL with a double IOL actually, and there's an IOL, PCIOL in sulcus. So it was a badly kind of fibrosed situation with the retina. The IOL was not even visible initially. After removing a lot of membranes, the dislocated IOL is seen. So this is what we all should avoid. And this IOL is lifted up, and now you'll see how the other IOL which is in sulcus is pushed to one side, and then this is taken out. So there's already an IOL which has been kind of pushed to one side, the IOL in sulcus, and this is being taken out from the side. Fortunately this was a foldable IOL, so it was a little malleable, and it could be taken out without disturbing the PCIL in sulcus. And then the RD was managed.
Thank you. Thank you. Can I?
Yeah, sure. Thanks.
Done?
Yeah, one last video was there. Can I show it if I have a minute?
Yeah,
if I have half a minute?
we have only 10 minutes time, and Chirag is.
Okay, one last half a minute video. So this is another dislocated IOL, but in this case it's a double IOL. There's an AC IOL in place, anteriorly. So again, lifting it with the forceps, and you can see that there's an AC IOL there. So I'm just trying to take it out by creating some space, and because it's a foldable IOL, so I could do this. And it does need a little bit of maneuvering. Thank you.